Hello, my name is Lisa Green, and today I would like to discuss the topic of polio. Let's begin, shall we? Polio is a disabling and life-threatening disease. The key topics I will be discussing are characteristics of the disease, the name of the causative agent, as well as the type of agent, the most common method of treatment, and I will show visual aids of what the virus looks like in or on the body. To begin, let us first discuss what polio is. Polio is a disabling and life-threatening disease which can infect a person's spinal cord, leading to paralysis. Poliomyelitis, or polio for short, is a disease caused by poliovirus. Polio is caused by a virus that lives in the intestinal tract and sometimes in the throat. Polio was eliminated from the United States in 1979. However, polio still exists in some developing countries. Characteristics of the disease include symptoms such as fever, fatigue, headache, vomiting, stiffness of the neck, and pain in the limbs. Although up to 95% of all persons infected with polio will have no symptoms. How the disease affects people who have it. Most people recover from polio without any problems. However, approximately 4 to 8% of those with polio develop health problems such as meningitis, and less than 1%, or 1 in 200 infections, leads to irreversible paralysis, usually in the legs. Among those paralyzed, 5 to 10% die when their breathing muscles become immobilized. A small group of people will develop more serious symptoms that affect the brain and spinal cord. Paresthesia, feeling of pins and needles in the legs, meningitis, infection of the covering of the spinal cord and or brain, or paralysis, can't move parts of the body, or weakness in the arms, legs, or both. Paralysis is the most severe symptom associated with polio because it can lead to permanent disability and death. Improvements in limb paralysis can occur, but in some people, new muscle pain and weakness may develop 15 to 40 years later. This is called post-polio syndrome. These are images of poliomyelitis in some cases. What causes polio and how is it transmitted? The causative agent is the poliovirus. Poliomyelitis, or polio, is a highly infectious viral disease that largely affects children under 5 years of age. The virus is transmitted by person to person, spread mainly through the fecal-oral route, or less frequently by a common vehicle, and multiplies in the intestines, from where it can invade the nervous system and cause paralysis. Polio can only be diagnosed with laboratory testing. Taking samples from the stool or throat are common ways to test for polio. Anyone who has not been vaccinated can get the disease. Because there are people throughout the world in the United States that are not vaccinated, it is possible that infected travelers can carry polio to unvaccinated people. The period between exposure to the virus and onset of illness is usually 6 to 20 days, but can range from 3 to 35 days. Is there treatment for polio? There are no specific medications to treat polio. If you have paralytic polio, you'll receive physical therapy. If your breathing muscles are weakened or paralyzed, you'll need mechanical ventilation, a machine that helps you breathe. You might be able to improve your symptoms by drinking fluids such as water, juice, and broth, using heat packs to help with muscle aches, taking pain relievers such as ibuprofen, Advil, Motrin, doing physical therapy and any exercise recommended by your healthcare provider, as well as getting plenty of rest. Is there a cure for polio? Furthermore, there is no cure for polio. It can only be prevented. Polio vaccine, given multiple times, can protect a child for life. There are two vaccines available: oral polio vaccine and inactivated polio vaccine. Both are effective and safe, and both are used in different combinations worldwide, depending on local epidemiological and programmatic circumstances, to ensure the best possible protection for populations can be provided. Vaccination is the best way to prevent the spread of polio. Widespread immunization against polio is critical to controlling the spread of the disease and preventing disability. In addition, everyone should avoid close contact with others who are ill, stay at home if you are ill, wash your hands with soap and water after toileting, changing diapers, and before preparing and eating. If soap and water are not available, use an alcohol-based hand rub. Has polio been eradicated? Vaccines have eliminated polio in many parts of the world, but we're still working to completely eradicate it. As long as polio still exists in any part of the world, it can come back and cause severe illness in those who aren't protected by vaccination. The best way to protect yourself and your community is to get vaccinated. Here I have my references for my presentation. Thank you very much.